One-on-one course, guys, here at SI was designed to really do a couple things. After Core 1, anybody that needs a little one-on-one attention can actually schedule a one-on-one course privately with one of the senior instructors. They have to take Core 1 at least to have some of the foundational principles. Core 1, you can do one-on-one as many times as you want to, and there's some cats that really like that one-on-one personal attention because they can learn faster and quicker. Even though our courses are actually more of a residency style, about 6 to 8 doctors, period. One-on-ones are designed to work on some of the weaknesses that a doctor has. So if a doctor is weak on sinus lifts or immediate osseointegration with hard torque implants or struggles in a certain situation, they can always jump in and take a one-on-one so we can get them up to par in the areas of weakness. We have other doctors that just prefer one-on-one for the solo nature of working one-on-one with one of us senior doctors. You typically work at a faster pace rate. You're coming into Arizona. You are with surgery for 2 slamming days. You will be tired. They're usually 12-hour days. Most of the doctors will get around 24 implants in about 2 days. So the one-on-ones also are being taken advantage of when you start getting to the higher realm of things. So when you're, in Core 4 and you're really learning hybrid placements or bridge placements, and you've got a couple arches under your belt, but you really just want a couple more, you can come and take a one-on-one with us, and we'll be able to give you that extra cases that you can put underneath your belt with guidance.